is the DSM-5, that is Diagnostic and Statistical Manual of Diseases. In its fifth version, they tried to simplify the terminology. For example, previously the bedwetting was called as nocturnal illnesses, but now, and similarly sleepwalk, which is nowadays sleepwalking, which was previously known as somnambulism. The American Psychiatric Association has recommended that the kids should not be confused because they don't know about the Latin words, the Latin language. So therefore, they try to avoid using the Latin words and so on. So what is the normal the stage of fear? Generally, if you look at the baby, up to 6 months, loss of support and loud noises and sudden movement can lead to fear among infants. If you look at the from 7 to 12 months, the strange or sudden appearance of large object of loud noise can lead to fearfulness. Now, these fearfulness condition, especially if you look at the 1 year age, separation from parents or strangers or injury or toilets, these are all form which lead to fearfulness among our infants. And if you look at the end of this slide, that at 13 years of age, the fearful thing is crime, being hurt, war, nuclear war, grades, peers, family, and nowadays, if you look at the COVID-19, the coronaphobia, which I have coined the term coronaphobia, so people are fearful. So, is shyness is a part of social anxiety? No. Shyness and anxiety disorder are two different things. Shyness is considered a normal personality trait that combines with the experience of social anxiety. Many people who are shy do not have the negative emotion and feeling that accompany social anxiety. So, social anxiety is characterized by the negative emotion and feelings. Uh, so these are the various condition. If you look at this place, how people are having social anxiety, or most common, this is the most common anxiety. And in our country, developing countries like Pakistan, India, Bangladesh, where the kids are or the children are not encouraged with their simple innocent questions, so rather they are threatened not only in the home but also at the school, and even corporal punishment, all these things, and bullying among the peers groups. So these are all factors that lead to social anxiety. The prevalence of social anxiety, lifetime prevalence around 12%, and the difference has been recorded, especially in the European countries and countries where there's cultural difference and influence. The prevalence may be low or high. The median age of onset is 13 years. Generally, at 13 years age, the person can have social anxiety. The clinical presentation can be in the form of physical symptom, cognitive symptom, and behavioral symptom. The cognitive symptom may be in the form of concern about embarrassment or fearful of being assessed by others. And they consider that they may be uh, doing like some thinking like having crazy or stupid appearance, and fear of appearing inarticulate when conversing, when having conversation with others. The physical symptom can be in the form of tremors or disturbance of voice, palpitation, sweating, gastrointestinal discomfort or diarrhea, blushing, and muscle tension. And the behavioral presentation can be in the form of avoiding of the feared social or performance, especially if you look at the going to on the stage or dice, and it can be in the form of avoiding eating, drinking, or writing in the public. The subtype of social anxiety disorder may be generalized or non-generalized. Generalized subtype is a fear in almost all social situations, whereas the non-generalized is a fear of speaking in the specific area, that is in the front of groups only. And approximately 30% of the patient with social anxiety are having generalized type, while 70% are non-generalized type. The typical social fear situation can be in the form of interactive or performance. The interactive can be attending social event, conversing in a group, speaking on the telephone, or interaction with higher authority figure, making eye contact, ordering food in a restaurant. All these can be interactive social situation for anxiety. While performance can be in the form of public speaking or eating in public or writing in check, using public toilets, taking a rest. So these are all, and speaking up at a meeting and giving presentation. These are all the types of the social anxiety for related to performance situation. The performing situation or interactive situation, this is just repetition, uh, writing in front of others or eating in the front of others. There are seeking medical, if you look at the interactive, can be in the form of seeking medical help even, or meeting or talking to people in authority. The differential diagnosis one of social anxiety can be panic disorder with agoraphobia, or agoraphobia without history of panic disorder, or separation anxiety disorder and generalized anxiety disorder. And a pervasive developmental disorder and schizoid personality disorder can also mimic social anxiety disorder. And the other personality disorder is avoiding personality disorder, which lead to appear to overlap extensively with generalized subtype of social anxiety disorder. The former may be more severe variant of generalized anxiety disorder, generalized social anxiety disorder. Social anxiety disorders has been having the following diagnostic criteria in DSM-5. DSM-5 is the American Psychiatric Association classification, that is diagnostic and statistical manual in its fifth version. So one is the marked fear of anxiety about one or more social situation. The second can be the individual fear that he or she will act in a way or show anxiety symptom that will be negatively evaluated. The C can be the social situation almost always provoke fear or anxiety. And the fourth is the social situations are avoided or endured with intense fear or anxiety. There are other symptoms of this, and if you look at the F, the fear, anxiety, or avoidance is persistent, typically lasts for 6 months or more. So this is the classification of DSM-5, and here you can see that one of the other characteristic is that it should not be, if you look at the J, it should not be due to medical conditions such as Parkinsonism or obesity, because in Parkinsonism, people are having coarse tremors, so therefore they try to avoid social gatherings. Or if somebody is having disfigurement of or burn or injury, he or she will try to avoid facing other people. So this is one of the requirement, that the condition should not be due to medical condition, and we have to specify that it is performance only or it is the other way around. The social anxiety disorder assessment tool can be in the form of social phobia inventory, brief social phobia scale, or Lipwitz social anxiety scale. So these are the various type, and if you look at this, so the brief social phobia anxiety is mostly used in the clinical trials. So first, if you look at the social phobia inventory, it has 17 component, and the scoring is written on the right side. The scoring can be from 0 to 4, where 0 is not at all, where 4 is extremely present. The interpretation can be in the form of 20 or less is no social anxiety disorder. On the other hand, more than 51 is severe, very severe social anxiety. The other scale is social interactive scale. These are all available on the internet. And the fourth is this social anxiety disorder, which has 24 component. The causes of social anxiety may be due to genetic factor, and it has been shown that 57% in female and 48% in male twins has been recorded the genetic factor. Parenting and family environment is also related to social anxiety, especially in our country. And I think one of the other environment is the school or madrasa, where the person are usually fearful. The adverse life events can be in the form of pre and perinatal factor, or the childhood history of anxiety may be there. Cultural and societal factors will also be there, because there are certain culture where the behavior is withdrawal behavior is acceptable, while in other culture it may not be. The gender aspect, that anxiety is more generalized, social anxiety disorder is more common in female, and the ratio can be 3 to 2. The social anxiety idiosyncratic ABC diagram. Here you can see that there are such a situation like eating in public. B can be automatic thought. What if I shake? Everybody will look at me. Everybody will think I am stupid. I will lose control. So these are the automatic thoughts, and this will be followed by emotion of anxiety, fear, anger to self, or it can lead to somatic or bodily symptom in the form of tremor, breathlessness, feeling hot or shaking. And the behavior can lead to take deep breath or grip spoon tightly, leave immediately, avoiding situation, avoiding eye contact. The predisposing factor may be that if some, and the assumption is that there are sentiment, if somebody really know me, he can see me horrible inadequacy. And the trigger can be in the form of anxiety thought or image, negative effects, and negative self-image, self-observation, bodily sensation, and so on. The prevention of this anxiety can be that individual factor and the family factor, the peer, school, and community factor, where bullying and stalking is one of the common cause that lead to such anxiety disorders. The treatment plan could be in the form of based on the severity of the condition, and then comorbidity of the condition, presence of concomitant medical illness, complication in the form of substance use or suicide, outcome of any previous treatment, and cost issue, availability of the treatment in given area. For example, in remote area of our country, psychotherapy or non-pharmacological intervention is lacking. And then the patient or the sufferer preference, which would think he or she prefer. The treatment, the goal of treatment are to reduce symptom, attain remission, restore function, and reduce relapse. And they can be achieved with non-pharmacological, because non-pharmacological therapy must be applied before jumping into uh, writing medication, especially benzodiazepine. The psychotherapy can be in the form of analytical therapy, ABC, analytical therapy, B is behavioral therapy, and C is cognitive therapy. And analytical therapy, which was the father of this therapy, is considered Sigmund Freud. And here the trauma which are at unconscious level are analyzed, and they are ventilated through free association, and that lead to uh, improving of the condition. The behavioral therapy was the coined by the J.B. Watson. Here, if we improve the behavior of a person, for example, if somebody is fearful to give a speech on mic, so if he repeatedly goes and try to give a speech, so later on he will, this behavior will eventually lead to reduction of the anxiety, and the person can overcome his fearfulness. The cognitive therapy is based on the idea of the Ehrenbeck, where if you improve the cognition of a person, so this will eventually improve the emotion and behavior. For example, तो उसको हम ये बता देते हैं कि माइक देखिए न काटता है, न थूकता है, न शॉट मारता है, तो इस तरीके से जो है द पर्सन विल eventually have a change his cognition or understanding. So therefore, और क्या हो जाएगा अगर चलो तकरीर गलत भी हो गई तो क्या हो जाएगा, तो this will eventually improve their cognition and reduction in the anxiety. The drug therapy became in the form of SSRI, that is selective serotonin reuptake inhibitor, or SNRI, the serotonin norepinephrine the serotonin norepinephrine reuptake inhibitors, or in the form of benzodiazepine, which should be used with caution because most of them lead to addiction. The practice in small step, first identify what situation caused the most fearful anxiety, then gradually practice these activity until they cause you less anxiety, and begin with small step in situations that are not in overwhelming, considering practice these situations. So these are the various intervention that one can use. uh, so the phobias being in a meeting at work was dealt with first through imaginary desensitization. And imaginary desensitization, here the person is asked to sit in a small group, first for few person, and then later on for 15 minutes, later on then for more than 5%, and similarly, so they are gradually exposed to situations so that a desensitization can be achieved. Treatment option of social anxiety pharmacotherapy, that was already discussed, but here I want to show you that the SSRI, the escitalopram, paroxetine, sertraline, and fluoxamine are category A and recommended first line, and the dose are written that escitalopram can be given up to 20 milligram, paroxetine up to 50 milligram, sertraline 150 milligram, fluoxamine 300 milligram. The venlafaxine, which is SNRI, serotonin, norepinephrine reuptake inhibitor, are also in the category of A, and the dose can be up to 225 milligram. And the rest of the medication, you can see that monoamino oxidase inhibitors are less likely to use because of the complication in the form of hypertension. So these are the various medication. Cognitive behavior therapy for social anxiety disorders are techniques that are used for by the psychologist or even psychiatrist, and there are many studies that have shown that equal change in the brain seen by the functional MRI or the PET scan. So there are evidence-based intervention. The course of these social anxiety disorder is usually chronic condition requiring long-term treatment. And the studies have shown that longer duration of illness does not appear to negatively influence outcome of the therapy. So therefore, the intervention can be done anytime, even if the intervention is done after years, the outcome will be good. Predictor of poor response can be early onset of social anxiety, that is below 19, increased severity of the symptom, and generalized subtype, as I have discussed. And comorbid other mood disorder can also be having poor response. With this, I'll end my talk. Thank you very much for your attention and concentration, and I'll be glad to answer any question if you have. Thank you. Assalamu alaikum.